Yeah.
Did you make cheesecake?
It's not a pizza.
Well, let's talk about the pizza. John, then. How many people in the world have hepatitis C?
30 million. 30 million.
Rolando knows. Of course, Rolando knows. How many people in the world? 100, about, it's estimated 170, 200 million people have hepatitis C in the world. And in the U.S.?
20 million.
300.
Yeah, we'd say 3 to 5 million. And these are statistics on how many people have hep C or who've been exposed.
5 million is exposed, 3 million.
Exposed. Right, because for years we said there were 4 million, and how did we get those numbers? Yeah, from sort of telephone-based surveys, and so really we missed about 1 million people because they were calling up people at Santa Rita saying, "Hi, have you been tested for Hep C?" I don't think they have, do they have phones in your cells when you're incarcerated? No. So we missed a whole lot of people.
Depends on who you are.
It depends on who you are. But these were exposed, and so what we're saying is that what percent of people who are exposed have hepatitis C? And what's the difference? About 75% who are exposed have hepatitis C. And what's the difference and how do you tell? Because most people will just tell you have hepatitis C. And how do you tell the difference?
You go to a
Viral
different test, quantitative or qualitative, as opposed to antibody. Antibody test will tell you if you've been exposed. Qualitative or quantitative test will tell you if you have a viral load, then you actually do have it. Or if you have a genotype, then you do have it.
So we have two different kinds of tests. We have antibody tests and we have tests against the virus. And what you're saying then is that one test tells you you have the infection and one test tells you you might have the infection.
Correct.
So why wouldn't we just use the virus test? Right. This is really the main reason, because this is a much more expensive and challenging test to do. And so why would you do it? If you have a cheap test, this is probably about 10 times more expensive. And the problem with the cheap test is it doesn't tell you you have hepatitis C, right? And that's one of the issues that comes up. If you're out there doing screenings, those of you who do stuff like Orlando does, you give people the information, well, you probably have hepatitis C. You know, you need to go get an additional test. And that doesn't feel very good.
But it does tell you if you don't.
Right.
It usually does. That's very good information. So if the test is negative, let's talk about that. What does it mean if your antibody test is negative? It's a very good test. So if your test is negative, there's only a microscopic chance that you actually have been exposed. This means you're okay. You have not been exposed. So you don't have to worry about it anymore, right?
Well, 6 months all over ago.
Right. I mean, you're right. Well, there you go. What if I poked my finger with a needle that had Hep C on it last week?
You still get it.
20 weeks.
What would you
20
expect?
weeks.
Yeah, you expect this to be negative. So
Right.
the window of opportunity for a test like this is what?
6 months.
Yeah, really at the upper end of normal. You probably should go out to 6 months. Most of the people will turn positive by 8 to 12 weeks.
And if you want to treat it in the acute stages, you want it a little bit before 6 months.
Does your white blood cell count have anything to do with hepatitis C?
That's an interesting question. What do people think?
Yes.
Yes, it does.
It does, but it also is indicated with many other things, so that alone would not tell you that you have hepatitis C.
What kind of white blood cell count thingy are you asking about? Elevated white blood cell count.
Yeah.
Right.
Elevated.
That's a thing we look for on blood tests a lot. What does this kind of tend to mean?
Vitamin
But the reason we often look at it is we're wondering if there might not be an infection. Do you typically see the white cell count go up with hepatitis C?
No.
What of the standard tests that we do, aside from the specific hep C test, what are typically abnormal when you have hep C?
Liver enzyme.
There's a separated test. The one you talked about
Albumin,
last week.
bilirubin, albumin.
Well, I'm kind of glad to hear there's answers all over the place, because the truth is, there's no good answer to this. That's absolutely right. This is what we talk about a lot, ALT, and what's that? That's a test that most people will get if the doctor's just drawing your blood. And so if you have hep C, that should be elevated, right?
No.
Yeah, the main problem is it can be elevated or it can be normal. It doesn't really matter. And if it's elevated, what does it mean?
It's usually quite, it's really elevated in the acute stage.
What's going on? What's the definition if your ALT is elevated?
Went a little further than it was.
Liver.
Correct.
ALT points to the liver.
Right.
You have liveritis, right? You have liveritis if your ALT is elevated. You can call it that, or you can use the other word, right? It's by definition
Hepatitis.
hepatitis. And so a lot of people think, oh my God, you have hepatitis, get away from me. Well, you know, is it infectious?
No.
Can be. It can be, but does it have to be infectious? No. There's a lot of different causes of hepatitis. There's one that you get, the kind of hepatitis that you can get from something that will make your hep C go faster, which is alcohol. Can alcohol cause hepatitis?
No. Oh, yeah.
Oh,
Yeah.
yes, yeah.
Roasted.
Particularly binge drinking. If you go on a really good binge,
Oh.
that's how what? That's how you got it? Actually, you know this because a lot of people, alcoholics, people who have alcohol problems have the same amount of hepatitis C as everyone else?
No.
No, it's a little bit more serious.
They might not even have hep C, right?
No, they could
No, they
get
have cirrhosis. Cirrhosis.
fatty liver disease.
Here's a group of everyone, and here's a group of AA people. What percent of everyone has hepatitis C in this country?
3 to 4.
Has been exposed by
1 out of
2%.
33.
That's a little bit less than that. How about alcoholics?
No, higher.
40%.
40%.
Yeah, I don't know if it's high as 20%, but it's considerably more than 2%.
I would
Like
say, yeah.
5%.
We're talking about hepatitis, hepatitis C.
Hepatitis.
Hep C. This is Hep C.
Hep C alcoholic.
Anytime
So
you have blackouts, you
is
know.
Hep C, do you get Hep C from drinking alcohol?
No. But if you drink.
Right, well, this comes up, a lot of people think, there's a couple of misconceptions about hepatitis C. One is that you can get it from drinking alcohol.
Yeah.
I know, we sound, be prepared for these because you just want to go like, that's so stupid. But a lot of people come up with that. And you just want to be prepared because, explaining why that doesn't make sense is not as easy as you think. Right? Because alcohol can cause hepatitis, and Hep C can cause hepatitis, right? But they're completely different. Can you get hepatitis from drinking alcohol?
Yes.
Yes.
Can you get hepatitis C from drinking alcohol?
No. They can use dope after.
You can't get it. It can make your hepatitis worse.
Yes.
See, you can see how people can get confused about alcohol and hepatitis C. It does not cause hepatitis C. So why do people in AA meetings have more than 2% of the population?
And they did drugs too.
Do other things.
Right.
They're risk takers.
No,
Those blackouts would be crazy.
How do you get Hep C? Yes,
Blood
right.
to blood.
Now, look, if you drink alcohol before you experiment with other drugs, and then you let that go instead of kept drinking alcohol, Is that the same risk? No, you might not like me. I haven't used any drugs since 1979, injection. All right, but I used a lot more after that. But alcohol was my main ingredient. Okay? Now, when you said that, the alcohol was what's called that nurtured it, or like, you ferment the egg, or whatever you're talking about. Now, that's what I'm guilty. I want to know. Now, I think, I don't care what I did in the past. What I'm still doing is, what I'm trying to get away from, they gave me alcoholic, hepatitis, I want to get rid of all of it. Okay, so you don't care, I don't care what the cause of it was, you got the cure. And just tell me what I have to do to keep them, making it worse.
Well, I often will go, there's the families of the patients we see here are often way harder to deal with than the patients we see. Really? Yeah, because they come up with nonsense like "stay away from me" and "you can't drink out of that glass" and "you can't use that
I did
fork,"
that before they found out.
and that sort of thing. So we really need to understand these things. And you look at this, and you might think that alcohol will pass Hep C. How about Cocaine Anonymous? It's your CA meetings.
yeah.
What?
Well, that do too, yeah.
Bloody throat.
Even higher.
Right,
International.
yeah, international.
In the NA?
Yes.
Right.
So we have these two here that, does cocaine pass on hepatitis C? Using cocaine pass on hep C?
It could.
Now that could, now just by boozing it does not pass on hep C, right? Because drinking, sharing, blah, 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 that doesn't pass on hep C, so it's not the behavior itself. Can the use of cocaine, can the use of cocaine pass on hepatitis?
Yes.
So it's a method of ingestion.
Yeah.
How you use it can, so there's two reasons folks who have stimulant issues, it doesn't have to, could be MA too, right? Meth anonymous. There's two reasons that you see a higher risk for hepatitis C in this population. And what are they?
Blood.
IV drug abuse.
Okay, so how you use it, sharing stuff.
Then the straw.
Sharing stuff, right?
Right.
Which
Yeah.
might be needles, sometimes
Straws.
needles. Straws,
Straws.
pipes,
Yeah.
anything that can pass
Roll
on
up
blood to
money.
blood.
I think they also could cancel each other out.
What?
I think they could cancel each other out too.
You
Say if
might,
you got really drunk and then you sobered up on the cocaine, and maybe you wouldn't get the hepatitis C.
Oh.
well, but we're already saying that alcohol raises your risk. But there is another reason.
But also with addiction, you become lazy. Once you become more addicted, you can't hide it from people anymore. There's certain things that you become lazy with. You don't wait to get a clean syringe when you have to go to the med.
Well, here's the other reason. When you're using cocaine,
Right,
you
there
do
you
a
go.
lot of really crazy
There you are.
Right,
Yeah.
absolutely.
And this also goes for doing a good bit of alcohol. You do things that in your finer moments that you might not choose for yourself. You don't make good decisions always when you're.
You don't answer the phone for a few days sometimes.
Under the influence.
It's not exactly answering the phone, but you know what I'm talking about. So there are a lot more risk taking, as Amy said, when you're not in your right mind. And cocaine and alcohol and meth.
Anything that impairs your
heroin,
judgment.
impairs your judgment. And so it probably really relates more to that than anything else, except, in the case of how you use these drugs, if it involves blood, then it can increase your risk.
Doctor,
Right.
you say drinking causes alcohol, what kind, or causes hepatitis, what kind of hepatitis?
That's an easy one, I'm so glad you asked. Alcoholic hepatitis.
Right.
Oh, yeah.
Mention on the letter then. No.
Ah,
Burns
okay.
out the
Good
tissue of
question.
your liver.
So alcoholic.
Are you drunk?
What does it mean? How do you tell if it's a virus? How do you tell if it's an infection?
MSC after whatever.
It's a letter.
It's a letter.
So the simple act of putting a letter after the word hepatitis means it's one of the
Viral
hepatitis
hepatitis.
viruses.
Hepatitis just explains a condition, right?
It's just a thing, it's like
Right.
tonsillitis.
Swollen
And
type.
it's just a swollen liver.
That can be caused by a number of things.
Exactly,
Yeah.
but if it's got a letter after it, I mean, what is hepatitis L?
Doesn't exist.
Doesn't exist. So what have we got, what letters have we got going on right now?
A, B, C, D,
A on down to E.
Oh, there's E
A
in
to
there.
the
Amy and I were so excited when we saw that first case of E here. Still only one. How are A and E similar?
It has a vowel.
Can't get one without
doesn't
this
vowel.
It's fecal oral. If it's one of the vowels, it comes from the vowels. How much of this do we see?
That's
Hardly
interesting.
at all in the United States. We had one case from a guy who went to India. He got sick in India.
How is that passed on?
And E is a vowel.
Oh, I got you.
So same way. It's just not around that much here
Right.
as opposed to A, and so we don't see that much of it. The others are different. How, are they related? Another misconception that you'll want to deal with is there's this perception among some people that if you have A, then it goes to B, and then it keeps getting worse, and then it goes to C.
They're all different.
They're all completely, really, well, not completely different. Are there, I'm gonna give you these, A through E. Are there any two that might be related in there?
A and B.
A and B and D.
B and
non A, non B.
B and D, yes.
E and D.
They
C
say
and D
they're
is
not,
different.
well, there's a little partnership going on between two of these. And it's B,
And D.
they're not exactly related, but how are
They
they?
coexist, one feeds on the other.
You can't get it.
Right.
You
Can't
have B.
have
B
D without having B.
Right, B is the hitchhiker, right?
D's the hitchhiker.
B can't
What'd
build
What'd you
without the
say,
other,
Triker?
right?
What'd you
D.
say?
B.
D.
D.
D is the
D is
D
hitchhiker.
is the hitchhiker. D
Okay.
is a hitchhiker. So if, I mean, nobody in this room, no, almost all of you, none of you have active hepatitis B.
Yes.
What if I poked all of you, you do not. What if I poked all of you with a needle that had hepatitis D on it?
There's nothing for
Wouldn't
it.
go anywhere.
Da, 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 da,
Don't have B.
here's, right?
override the B.
No,
No,
the D
D.
can't survive by
Good,
itself.
okay.
B.
There you go.
Right.
So these are not related.
Now, wait a
These
minute.
viruses, these are
My
the
claim is
Smiths.
my
Okay.
day.
Okay.
I gotta
Bye.
go.
I'll call you later.
Okay.
Thanks for the drugs.
Thanks for the points.
Deliveries.
Why doesn't this crowd have B? Is that a big area thing? Like,
No,
they're
they're
not-
going in Southeast
Like
Asia.
B.
Right,
Right.
because, you know, why are it's like, oh, chances are you've been exposed to this, but, what are you, so in this clinic,
You got it?
I would say, you know, we see mostly injectors here, so that raises our risk. But you probably, if you show up at this clinic, you have about a 90% chance of having antibodies to hepatitis C. What are your chances of having antibodies to hepatitis B?
60.
Would you say?
For me, it's 100%.
Well, if you get vaccinated.
Yeah.
Very rare,
Very
very rare. When you can't be,
Got it?
when you vaccinate, you can't catch it at all.
Actually pretty common, isn't it?
It's about
I didn't
90%.
have the antibodies.
Yeah, I think I've been vaccinated
Why
for
is
that.
I've been vaccinated.
It may be a little less than 90%, I don't know exactly, but it is almost the same. Exposure to these, according to antibodies, is about the same, but it means something very, very different. If 90% of people who've been exposed to hepatitis C at this clinic, why?
Because we're at this clinic.
Because there's a sharing of blood to blood.
Bros.
Well, first of all, people are referred here for,
Yeah, we're here for
course,
that
right? I
reason.
mean, it's called ascertainment bias. But, you know, people have risk behaviors consistent with it. But what's the number one way you pass on hepatitis B?
Sexually transmitted is blood.
Sex is number one and number two is blood.
Then the water, whatever the environment,
Can water pass on hepatitis
well,
B?
Rock and roll.
It
like
could
you
water.
have water,
Yeah.
like you use the restroom,
water.
and, you know, and some like people in India, some
And
people,
they do
like
that?
people would say,
It's
yeah.
not the way you pass on B.
That's
Well,
it.
how
It
you
is
do
not
it?
passed on that way.
You got to go
It
in
is
some facts.
blood, sex and blood.
Blood, and what else?
It's
And
on
birth
sex.
mother, birth mother.
Yeah,
Yeah, I was just
Okay.
gonna say, in a lot of
Yeah.
countries, it's also passed
Oh,
down
vertical.
Yeah,
from mother to child.
But water,
yeah.
glasses, forks, knives,
Glasses,
cooking utensils, none of that passes on B.
Okay.
So if you have hepatitis B, can you work in a restaurant?
Yeah.
Yeah.
And if you have hepatitis,
No.
yes, you can. Absolutely you can.
Not A.
Why? Because, part of your
Not a
work
foul.
in a restaurant isn't, having sex with the customers.
Ah.
So it's okay, as long as you're not working in one of those restaurants where, you go to eat and have
Okay.
sex.
Please come on.
Alice's restaurant, right, so you can't work at Alice's restaurant.
You can only eat there.
You poke everybody with hepatitis B, and nobody currently has active hepatitis B, then nothing will happen. What if somebody develops hepatitis B and they have been pre-poked with B? Do they develop it because they can hitchhike on?
So if I poke you today and then you go out, let's say you've not been vaccinated, so
Correct.
you're one of the 10% of people here who are at risk for hepatitis
Yes.
B.
Which one has a display? I mean, that turns you yellow and everything?
Well,
A or B?
all of them,
That's jaundice.
After-
all of them
After a while,
can,
but
all of them
I've
can.
been yellow before.
Oh, it helps
Not
out.
that-
You often would,
Listen,
if people have used needles and they say, yeah, when I was 20, I turned yellow. What do you think about that?
Acute,
Like jaundice.
acute phase.
Which of these was it probably? Yeah, most likely when you turn yellow, it was B. Can it be C? Sure, sure. In fact, if you poke yourself with a Hep C needle and you turn yellow, what is your likelihood that you're going to get rid of hepatitis C?
It's actually,
It's very good.
5%.
It's the same, so there's this very interesting thing where if you get one of these viruses, B or C, and your liver goes nuts. So your liver enzymes go off the charts. That means your body is freaked out, your immune system is attacking your liver big time.
Great
You have a
response.
better chance of getting rid of these than if your body says, no big deal.
Right.
Well, Dr. Sylvester, can't you live with B and C?
not very comfortably.
Most people do.
Right, okay, that's what I'm talking about.
But they are very different viruses, and just like we say alcohol and Hep C are like gasoline and fire, something you don't want,
Mhm.
B and C together
our bad.
are bad.
Well, you got them both.
How, is that common?
Yes.
Yeah.
Because I just said 90%, 90%.
that's not good.
It is so not common. I think here we have, out of 2,500, there's probably 5 people who are co-infected with hepatitis B and C. That's it. But I just said, what are we talking about though? I just said 90%, 90%. You would think that'd be about 80% co-infection, right?
You get rid of
You would think.
I would say
B goes away.
one overshadows the other.
94%.
Well, okay.
One overshadows the other.
94% of the people would be cleared.
There you go.
Okay, so first of all, you have to ask what we're talking about with the B tests. And you think the Hep C tests are confusing? Oh my God, the hepatitis B test will drive you crazy. But the bottom line is, if you are an adult and you get exposed to hepatitis B, you've not been vaccinated before, and you've not been exposed before, what will generally happen?
Just get rid
You get rid of it by the
You get very sick. Will you get rid of it?
of it. Antibody, build up antibody.
Not really.
Yes.
Yeah, that's
It does your viral load.
Dormant, that's how you define get rid of it.
Dormant.
Have an antibody.
If,
Yeah.
this is a word we don't use with C. A B can go dormant, and when it disappears from your blood, is it ever gone from your body?
No, no,
Correct.
right.
Why is that?
Because this line
It's a
dormant, it's
DNA
not dead,
virus.
pure.
It's DNA virus, and we're
Right.
are DNA humans,
It's gonna be
and
with
so
traits.
there's a nice match there.
Right.
And that is the reason, why should you get vaccinated for B? Well, first of all, because you would get really sick if you got it,
You don't want to
right?
see.
Yeah.
but, and another is that you might keep it chronic, it might stay active in your body. And what are the chances of that if you get it as an adult? It's about,
10%.
well, it's more like, it's 5 or 6%. If you get it as an adult. If you get it when you're born from your mom, what are your chances of keeping it in your body? Over 90%. Very high. The younger you get it, the more likely it is to actually stay in your bloodstream, divide in your liver, and cause problems. But most of the time, it just goes dormant. So in adults, it's like 95% of the time, it goes dormant. Your tests will be positive. I say here, 90% of people have positive tests for B. They've been exposed to hepatitis B or vaccinated. One or the other. The tests that we do to check for previous infection are a little more complicated than the ones for hepatitis C. And it gets you talk to doctors and they're constantly getting confused. But very few people here actually have hepatitis B. Most people have either been exposed or vaccinated, but if I told you we have 2,500 people who are in our database who've been screened for hepatitis B, and I'm going to tell you almost all of those have antibodies to hepatitis B. If I told you that 5% of these had hepatitis B, I mean, what number is that?
About 100,000.
No.
Right. This is 110, right? Yeah, 120. So 125. But I just told you I have 5 people co-infected.
A lot lower than the percentage.
So what's isn't that interesting? What's going on there? There is a very interesting and poorly understood reciprocal relationship with B and C.
The C virus is beating up the B.
Yeah, they
Yeah.
beat each other up, and
Yeah.
then often usually one will dominate over the other.
Well, you feed off each other.
What?
No.
Viral
You
warfare.
get B and you get, then if you have B and you get C on top of it, B will go away,
Let the battle
Go dormant.
begin.
Or low viral load. Very
will
low.
go dormant, yeah. So
Or
it's
dormant, zero
You know,
viral.
I wonder about one thing.
zero, it can be 0.
You know, I know they use therapies with DNA where they put DNA in people's bodies and it affects their DNA. So can having this dormant B virus in your, DNA virus running through your system, can it affect your own DNA and maybe harm your future children or screw
Well,
up
you
your
can,
future DNA?
you know,
I know
it's
it's
in your
kinda
liver,
complicated.
right? Yeah, it's a complicated question.
Yeah,
I mean, we know that it can be passed on by women at child at the time of birth, right?
Right.
That's very, very
Even
common.
dormant,
if it's
or
dormant?
does it have to be active?
yeah.
It has to be active, if it's active. If you have the virus in your blood, that's one thing, but there's another test. The test that tells you you have hepatitis B chronically, that's infected is what? Hepatitis, very good. So there's the antibody, we talk about antibody. The thing that sticks to antibodies, the term is what? Antigen. And so there's a hepatitis B antigen test that's the common one that we send. But it's the antigen on what part of the virus? Very good. It's on the surface of the virus. And if you don't get rid of hepatitis B, you still have you don't have the antibody. You didn't make the antibody. That's the problem. You didn't make the antibody that will get rid of this virus. And if you don't have the antibody, what you got? You got the antigen.
Right.
You've got the antigen. And so if you have the antigen, you will not have the antibody unless there's this very brief window when you're switching over from antigen to antibody after you got infected. This is a test that tells you you have chronic hepatitis B.
Can you still be vaccinated for hepatitis B if you had it and didn't get the antibodies, as in my case?
It depends on which antibodies you're talking about, because there are 3 kinds of antibodies that we routinely test for. If rid of the antigen, because I need the antibodies. How will that work? Well,
It's too late.
it's too late. You just need to be vaccinated. If you don't know your status, and you have the, what's the strategy? Or if you're out doing outreach,
Get another one.
vaccinate.
Yeah.
If there's a question, you vaccinate. Is there harm in it? No. There's harm in getting hepatitis C that far outweighs the opposite, right?
I was gonna ask you,
Yeah.
now isn't, hepatitis C the most dormant one, and if you get that, cleared or cured, that antibody will fight all the rest of them off?
They're totally different,
No, they don't.
totally different.
They don't go
It's like weapons that fight us versus weapons that fight space
Then you
aliens.
said hepatitis C will beat up the B?
Which ones, well, tell me about dormancy rates.
B.
B is most likely, is dormant what percent of the time if you get it as an adult?
95.
95% chance you're gonna go dormant. How about C?
There's no dormant.
0.
It can't go dormant. It's not DNA. I
You
mean,
don't have the antibody or you don't.
Oh, yeah, you're right, Tom.
Right, it does not go dormant.
No, it
It's either
doesn't.
there or not there.
There.
But if you have the antibody, what does it mean? Is it dormant?
No, I mean cured,
You've been.
It's
Yes.
not dormant, it's gone.
it's gone.
They are so
Right, cured.
different, these viruses are so different.
So you don't get any antigen.
You see why this is- Yes, there is antigen, because antigen is just a protein from the virus.
It's the word hepatitis.
Do we
people
test
get
for it?
confused.
Not yet. It's a really interesting issue because we test for, the blood test for hepatitis C, it looks for, it tells you you have it, looks for the virus, what part of the virus? The genetic material of the virus.
RNA.
But what you asked, is there antigen for hepatitis
B.
C in your blood? What do you think?
Yeah.
Yes, there
It's a foreign
is.
invader.
So
The word-
is there protein from hepatitis C in your blood? Absolutely. Wouldn't that be cheaper? You figure these hep B tests are pretty cheap. Wouldn't it be cheaper to, instead of doing an RNA test, which is pretty complicated, wouldn't it be cheaper to do a protein test? And why
Not if
are we
it's
doing
not
it?
developed. No, no, that's the-
Because a lot of things can
What?
elevate it.
Because they're-
It will. You could, these would be the same thing. If you could detect a protein from hepatitis C in the blood or the genetic material, either of those would suffice to tell you you had hepatitis C. So why don't we use a protein-based test, which is much easier?
More
Okay,
expensive.
is that like to throw this
It's
inhibitor
a hard question.
medicine?
Because a lot of different things can mess with the protein besides hepatitis.
I almost thought you were headed, so what do we know about, what does the hep C virus do in your body?
Hep C,
Is there one kind of virus in your body?
It's quasi-
There are gazillions of different viruses,
Right.
related viruses in your body. There's a whole family of viruses, and so the
mutate.
proteins vary widely. And
Right,
you try to make a test looking for a specific protein,
and it's not
and
there.
it ain't gonna work because there's just so much diversity of hepatitis C, whereas B doesn't have that kind of diversity. So today, we don't have a good protein-based test, which would be way cheaper to do.
Because it's all the different genomes.
Yeah, it just changes, each time each time
Right,
it
it mutates.
increases, hep C changes one
Right.
base pair.
Can you
And
use a
uniquely to
genotype
each-
test to detect hepatitis C? Is that
Yes,
allowable?
genotype, absolutely. If you have people who have no insurance, if you say, I have $100, that's it. What test should I do to find out if I have hepatitis C?
$100,
Can you have a
Yeah,
genotype and not have
blood bank.
hepatitis C? I mean, those would
Well, can you, or opposite, so we have three different, well, more than that, we have different genetic tests for hepatitis C, right? You have the viral tests, in the name of the, we'll say PCR, or TNA, and they can be qualitative, give you just a yes or no, or quantitative. We're not using this as much anymore because the quants are so sensitive. It used to be that you really want to go for sensitivity, use this. Most of the time we're using this.
Excuse me, the quantity is better than the quality? The quantity is
Well,
more?
No, why? I mean, does it matter if you have a high viral load? What does it tell you?
Nothing.
Okay.
It might tell you you're not responding to treatment.
Well, I see what you're
That's
saying. Yeah, right.
And then we have the genotype.
Then you go to
So
genotype?
another viral test is genotype. And so why, if you're $100, these are about the same. This is probably more like 120, and this is 90 some odd now. So this is cheaper. But if you had, $100 bill in your
You
pocket,
wanna go with the
approximately,
genotype test.
why would you get the genotype? That's what I would do.
Show you the
So,
genotype.
you know, if you have
It tells you
Right.
more.
Tells you
Let's
yes,
start
you
here.
have it, tells you
I know,
what
yeah.
kind you have. Right? Is it possible to have hepatitis C and not have a genotype?
No.
Yes.
No.
Yes.
Yes.
Sad, but true.
No.
It's rare. It's rare, but about 10 patients here
Wow.
don't have any clue what their genotype
Wow.
Right, no,
is.
no,
It
wait.
can be in the
Don't they have genotype B,
A
A, B,
million
C?
virus particles and then undetected, we
Right.
do not know what the
You
genotype
treat 'em
is.
like
Weird.
Is that because of all the different
Time.
viruses?
Can
y'all be quiet?
We would guess that it's because hep C is so different that there's the area where we do the genotype, which this is this region, 5' untranslated region. It's upstream of, this part of the genetic material makes the pieces of the virus. There's this area up here which doesn't make any proteins. It's just hanging out there. So usually there's no changes because this is the virus. So these are pretty stable. Your genotype's up here. The problem is some people have changed up in this area and we can't figure out what their genotype is. So what do we do?
You treat it for
Couldn't
the
be
worst
one.
case.
Exactly.
Right.
Worst, we assume the worst.
Dr. Sylvester, is that how, why they have in genotype A, B, and the rest of them?
Genotype 1 through 6.
2, 3, right?
1 through 6. And then there's these little
Subspecies.
1A, 1B.
Right.
These are minor differences. These are major differences between 1, 2, 3, 4, 5, 6. Minor differences between the little letters.
How do you treat
I had an
that?
outbreak of hepatitis from a
Worst
restaurant.
case scenario, 48 weeks.
When there's an outbreak of hepatitis from a restaurant, is that A?
Yes. Or it could be an outbreak in a restaurant will be. Unless it's Salas's restaurant.
A from the
Usually A. If you were in Bangladesh, you're in Bangladesh, it could be E.
Yeah.
But here, there's not that much E around. That would be wild.
It's still the shits, right, though? It still come from the bowels.
Right.
The bowel comes from the
Yeah, I
bowel.
heard about that too. That's what I'm asking. Okay, Doctor.
It's got confusing. It's
You got
hard.
any questions?
These are worth knowing because you can see why there's confusion. You talk to doctors and they're often confused about the test. That's why many of you have been told you have hepatitis B and C. And then we look at the test and say, no, you don't. Because they don't understand the tests. So you just gotta keep. What, Joe?
Back in 1 second, I hate to backtrack on you, but when you're talking about three things of hepatitis B, one thing I didn't understand, which said vertical, what does that mean?
At the time of birth, from
Oh.
mother to child.
Oh, okay.
I wondered that too, Joe.
I
Right.
didn't quite
Pass
know
it
what
on
you
to the
meant.
person who lives under you.
Underneath you, yeah. Thank you, Doc.
Thank you.
Ah.